Hey there, YouTube family. My name is James, and I wanted to welcome you to the Everything Healthcare channel. If you clicked on this video, then you might be curious about finally learning the difference between Medicare and Medicaid. These two terms seem to be interchangeable when I hear people mention them, so I am here to set the record straight and stop the madness. So Medicare is a federal health insurance program for people who are either 65 or older, have certain disabilities, or are folks with end-stage renal disease. Medicaid, on the other hand, is a joint federal and state program that provides health coverage to low-income individuals and families. Another major difference between the two is that Medicare is primarily funded by the federal government, while Medicaid is jointly funded by the federal government and the states. In general, Medicare is more comprehensive and covers more services, but Medicaid provides more financial assistance to low-income individuals. One easy way to remember this is to just look at the second part of each word. The care part of Medicare deals mainly with the coverage of services for patients, while the aid part of Medicaid deals with providing insurance for those who need it financially. I think a great place to start is talking about Medicare. And you might be wondering, how do I qualify for Medicare? You may be eligible for Medicare if you are 65 years or older, or if you have a permanent disability and have been receiving Social Security Disability Insurance, or SSDI, for at least 2 years. Also, you may qualify for Medicare if you have end-stage renal disease and require regular dialysis or a kidney transplant. You can also qualify for Medicare based on age if you are under 65 but have a certain disability or permanent kidney failure. You can apply for Medicare online, by phone, or in person at your local Social Security office. You should apply for Medicare 3 months before you turn 65, or if you have a disability, you can apply for Medicare as soon as you become eligible. It is also worth noting that there are different parts to Medicare, such as Medicare Part A, which is hospital insurance, Part B, which is medical insurance, Part C, which includes Medicare Advantage plans, and Part D, which is your drug coverage. Each part has different rules and requirements. And just so you know, working for a certain amount of years is not a requirement to qualify for Medicare. Like I mentioned before, Medicare is a federal health insurance program that is based more on age, disability, or ESRD rather than work history. It's probably important that I tell you about each part and what they cover, so stick with me here. Medicare Part A is the hospital insurance portion of Medicare, and it helps cover the cost of inpatient care in a hospital or skilled nursing facility, hospice care, and some home health care services. Eligibility for Medicare Part A is based on age, work history, and citizenship. If you or your spouse paid Medicare taxes while working, you may be eligible for premium-free Part A, which means you do not have to pay a monthly premium for this coverage. In order to qualify for premium-free Part A, you must have at least 40 quarters or 10 years of Medicare-covered employment. If you do not have the required work history to qualify for premium-free Part A, you may still be able to enroll in Part A and pay a monthly premium. This is known as paid Part A. The cost of the premium will depend on your work history, and it may change each year. You should know that if you are eligible for premium-free Part A, you will automatically be enrolled in it. If you are not eligible for premium-free Part A, you will have to apply for Medicare and pay the monthly premium. Likewise, many people who are eligible for premium-free Part A will also be eligible for premium-free Part B. Now, Medicare Part B is the medical insurance portion of Medicare, and it helps cover the cost of doctor services, preventative care, outpatient care, medical equipment, and other services. Eligibility for Medicare Part B is based on age or disability, and it is not dependent on work history or income. If you're eligible for premium-free Part A, you will automatically be enrolled in Part B and will not have to pay a monthly premium for this coverage. However, if you are not eligible for premium-free Part A, you will have to pay a monthly premium for Part B. The cost of the premium will depend on your income, and it may change each year. You can enroll in Part B during the initial enrollment period when you first become eligible for Medicare, or during the general enrollment period, which runs from January 1st to March 31st each year. If you are under age 65 and have been receiving Social Security disability insurance benefits for at least 24 months, you will automatically be enrolled in Part B. Now we can move on to one of the more interesting parts of the Medicare program. Medicare Part C, also known as Medicare Advantage, is an alternative way to receive your Medicare benefits. Instead of receiving your benefits through original Medicare, Parts A and B, you receive your benefits through a private insurance company that contracts with Medicare. Think Aetna, United Healthcare, Medical Mutual, etc. To be eligible for Medicare Part C, you must be enrolled in both Medicare Part A and B, and you must live in the service area of the Medicare Advantage plan you wish to enroll in. Medicare Advantage plans typically offer additional benefits such as vision, hearing, and dental coverage, and many plans also include prescription drug coverage, which is actually part of Part D. Some plans also offer additional perks such as gym membership, transportation to doctor appointments, and wellness programs. In terms of cost, most Medicare Advantage plans have no additional premium beyond the cost of Part B, while others may have a monthly premium. Out-of-pocket costs such as deductibles and co-payments may also vary from plan to plan. Furthermore, you can switch from original Medicare to a Medicare Advantage plan or vice versa during the annual enrollment period or during a special enrollment period if you have certain life changes such as moving or losing other insurance coverage. You can change your Medicare Advantage plan during the annual enrollment period, which runs from October 15th to December 7th each year. We're almost done with Medicare, I promise. Medicare Part D is the prescription drug coverage portion of Medicare. It helps cover the cost of prescription medications that are not covered by original Medicare. To be eligible for Medicare Part D, you must be enrolled in both Medicare Part A and Part B, and you can enroll in a Medicare Part D plan during the initial enrollment period when you first become eligible for Medicare. Like Medicare Advantage plans, Part D plans are covered by private insurance companies that contract with Medicare. Each plan has its own formulary or list of covered drugs, and the cost of the plan will depend on the specific drugs you take and your income. If you're enrolled in a Medicare Advantage plan that includes prescription drug coverage, you do not need to enroll in a separate Part D plan. Also, if you do not enroll in a Part D plan when you are first eligible, you may be subject to a late enrollment penalty, which will increase your premium for as long as you have Part D coverage. So the main takeaways from Medicare, in my opinion, are trying to see if you qualify for the premium-free Part A because it will save you a lot of money by avoiding the premiums. The other thing would be doing some extensive research into the pros and cons of Medicare Advantage plans and determining whether or not they are the right fit for you. I might do a video on this in the future, so stay tuned for that. Whew. That was a lot of information. Buckle up and get comfortable though, because we still have to talk about Medicaid and its many different features. So, Medicaid is a joint federal and state program that provides health coverage to low-income individuals and families. Eligibility for Medicaid is based on income, assets, and other factors, and it varies from state to state. To qualify for Medicaid, you must have a low income, which is defined as a certain percentage of the federal poverty level. The specific income limit for Medicaid eligibility varies by state, but in most states it's around 138% of the FPL. In addition to income, assets are also considered when determining Medicaid eligibility, and the specific asset limit for Medicaid eligibility varies by state, but in most states it's around $2,000 for an individual and $3,000 for a couple. Even though income and assets are some of the main factors considered when determining eligibility for Medicaid, they are not the only factors. Other factors that are considered include age, because Medicaid provides coverage for children, pregnant women, and older adults with low income. There are specific income limits for these groups, which are usually higher than the limits for non-disabled adults. To be eligible, individuals must have a disability that meets Social Security's definition of disability and meets specific income limits. And also pregnancy, because pregnant women with income up to a certain level may qualify for Medicaid coverage. Some of the biggest benefits provided by Medicaid are inpatient and outpatient hospital services, doctor services, preventive care, prescription drug coverage, rehabilitation services, home health care, long-term care services, and much more. It's vital to understand that Medicaid benefits vary state by state, and as some states have the flexibility to design their own Medicaid programs within federal guidelines. Also, some states have expanded their Medicaid programs under the Affordable Care Act to cover more people, and other states have not. In states that have expanded Medicaid under the ACA, eligibility for Medicaid is based on income alone, regardless of other factors. In states that have not expanded Medicaid, eligibility for Medicaid is based on a combination of income, assets, and other factors, and it is generally more restrictive. The main takeaways from Medicaid, in my opinion, would be checking to see whether or not you live in a state where Medicaid has been expanded. Not only that, but because this one seems to be more income related, you need to know where you stand in accordance with the federal poverty level. Everyone's situation is different, and it's about finding what options are the best for you and your family. Thanks for sticking around to this point in the video. I hope you are now armed with the information you were seeking, because it could make a big difference in your life. It would mean the world to me if you could hit that subscribe button, as I'm trying to reach my goal of 100 subscribers by March. Also, smash the like button if you enjoyed the content. I have something new for you every week, so stay tuned and see you next time.